We're back with Lourdes Medical Center and Dr. Arijit Chakravarti. He is a nephrologist, and we're talking about the symptoms of kidney disease. We left off talking a little bit about itching. Can you explain the skin rash, itching, how that develops on the patient?
So if any, kidneys, one of the functions that kidneys have is to filter blood and to filter toxins. Other organs do this as well. Liver does this as well, but in a different capacity. When some of those toxins build up, if the kidneys aren't filtering well, some of those toxins can also contribute to itching. Again, sometimes this can be a non-specific symptom, but it could also be related with kidney disease.
Sure, and the metallic mouth.
Yes.
What's that all about?
And that, I'm glad you brought that up, because that also helps me make an important point as well, that although the symptoms, as we were talking about before, can be non-specific, the other thing, of course, is that sometimes the symptoms develop late. So,
and when you say late, you mean late in life?
Late in the stage
of
the disease itself, exactly.
Gotcha. Okay.
So whereas someone may have some underlying mild chronic kidney disease or even moderate kidney disease, they may not have some of those symptoms of swelling or lack of appetite or malaise or easy fatigability or even swelling. But as the disease progresses, then some of those symptoms may become more apparent. For example, the metallic taste in the mouth.
Got it.
And of course, this has been the vexing problem for doctors, that we wish we could figure out if someone has kidney disease earlier to maybe try to slow down the progression. But sometimes the disease can be silent. And then once someone starts developing symptoms, it may already be that the kidney disease has progressed far. But we should keep in mind that that's exactly where you need a doctor to help.
Okay, and then I guess as these symptoms start to reveal themselves in the patient, a patient might go to just a general physician, and then the general physician would then refer them to a nephrologist. Is that how that would work?
Absolutely.
Okay.
And
then the diagnosis would take place. Okay.
That's right.
Gotcha. Right. All right, so we have actually more symptoms of kidney disease that we're going to show right now. Nausea and vomiting, very serious.
So some of these symptoms develop when the kidney disease has progressed and has gotten worse. Again, we think that it's related to some of the toxins that are building up, and so patients may have lack of appetite. Sometimes, very peculiarly, patients will tend to become more nauseous if they are eating a high protein meal, like for example, hamburger or chicken. All of a sudden they may find themselves becoming more nauseous compared to other foods. But again, this can be non-specific.
Shortness of breath was another one.
And that certainly does relate to, at least if it's related to kidney disease, if it's due to kidney disease, it's related to the patient retaining more salt and water. So then sometimes fluid can build up, not only just in the legs and generalize in the arms and legs, but also can develop in the lungs. And of course that can become dangerous if there's too much fluid in the lungs.
Now I remember seeing flanking or leg pain, and I wasn't quite, well, I skipped two. Feeling cold. Where does that come from? How does that manifest itself?
And I'll say this is a good time to bring up that the kidneys do so many different things, and of course I'm always very interested in kidney disease and as well as diabetes and hypertension. Feeling cold, again, can be related to toxins building up. The kidneys do a lot of other things. They function in working to keep your hemoglobin at an appropriate level, and if kidneys aren't functioning so well, then patients can become anemic. Kidneys produce a hormone, erythropoietin, or what people may also know as medication that's used to supplement when the kidneys don't make erythropoietin, a medication called Epogen.
Okay.
And erythropoietin helps keep people from developing anemia. So you or I, if our kidneys help produce that hormone, when the kidneys aren't working well, then we can become anemic. And that can contribute to fatigue or feeling cold, and not just a kidney disease.
And there are two more symptoms, dizziness and leg pain.
Yeah. The leg pain and and also if we just look at leg pain could be related to electrolyte abnormalities, causing muscle cramps. It could also be related to retaining salt and water and fluids. Your legs are more swollen, so that can be painful. When we talk about a flank pain, this could be a different type of kidney disease. For example, if someone has a kidney stone. Now, usually if someone develops a kidney stone, we don't think of that causing kidney failure. It happens to be that most people are born with 2 kidneys, and so if someone develops a kidney stone and they develop flank pain, it's preventing that kidney from making urine, but the other kidney may take over function until the kidney stone is passed.
I see.
So that could be one symptom of flank pain causing kidney disease if it's related to a kidney stone. But there are other types of diseases, less common diseases that could also just be related with kidney disease itself.
Okay. Now, what we've done is we've gone through the symptoms. Now, when we come back from the break, what we're going to do is we're going to talk a little bit more about organ donorship and transplantation. When we return, we'll be right back.